That I was asked to participate in this interview and video process by Mike Barbeau and Mr. Allen. I'm not receiving any compensation or any type of inducement for this. This was strictly voluntary on my part. I actually put myself in the TrenGuard, okay, and turned myself into as deep a Trenellenberg as we put any patient, right. And I was there for, I'd say, approximately 30 minutes. Right. And other than the fact that I developed a slight headache from vascular engorgement, I had no symptoms of any kind. And I'm sitting in front of you as a fairly, let's be polite here, fairly husky guy. For my day, we would husky at a not so severe 260 pounds. And once I settled into those, I did not move. You know, as the Trenellenberg progressed, I didn't change position, and I did not shift at all over the time that I was sitting there. And there were no other restraints on me. I did not have any positioning of the arms. I did not have my legs up in stirrups where they would have been, strapped in place, providing some counter traction. I was amazed at how comfortable it was for me to lie there. Okay, I had no symptoms in my shoulders or arms of any kind. This is a very well designed device. It's actually very easy to move on the table. It's incredibly adaptable. We've had some very petite patients. I mean, I literally had a lady who weighed about 105 pounds who went into this and did very well with it. And we've had people in the 300-pound range in this. And there's no shifting. We always, by our protocols, put the patient in as steep Trendellenberg as possible once we set them in the TrenGuard to make sure that it's going to be stable. And I never see more than a millimeter shift, or maybe two. It's well attached to the bed. I think the design is obviously for whatever weight class we would need to use. I have a lot of confidence that none of the patients that we're seeing here are going to have any brachial plexus injuries at all, as long as we're using this device properly. I believe that some of our surgeons who do work at other institutions also, for some of them it's been the first experience with the TrenGuard, and they seem very impressed with it also. Okay. I think one thing that I have done with a patient who did have some concerns in that area, has some neck symptoms, quote, whiplash injury, but normal appearing neck and normal appearing motion, is we put them in the TrenGuard, okay, while they were still minimally sedated before they actually went under anesthesia, and had them be in this. And how does that feel to you? Is this comfortable? Are we producing any paresthesia or numbness and tingling in your shoulders, arms or hands? Is this something that feels good to you? With one lady we had, the one I mentioned was about 105 pounds, was very petite, and I think she may have felt like she was maybe a little more cocked up with that than just a little more anterior with that, and she said it was fine, okay, but perhaps someone, of course, the trend for our patients is not being more petite, unfortunately. Okay, that having something that had a little bit smaller of a curvature, a little bit less rise, might be good for some of those patients. I think that's very unlikely. I think, as a suggestion, perhaps having a different heights of pad potentially available might, because that's the one thing that's not particularly adaptable. It's a fixed height, and if you have a patient who doesn't have a normal cervical curvature, that putting them in a more protracted or extended position like this could theoretically cause some compression. This disease, if they have active herniations and nerve root compression, I'd be surprised if they would be worried about having a robotic surgery before they got their arms taken care of. But perhaps someone that has some spinal stenosis, especially cervical spinal stenosis in this particular circumstance, if they were to be hyperextended, there might actually potentially be some cord compression if they're extended too far. I think so. I think so. I think that would help give us what we need, because then you're going to see people like myself who are 6'4", 260, and that area may not even be long enough. It might need to be a little bit longer to accommodate the entire cervical curvature. Okay. So it's a consideration. I think it's an excellent device, and I would certainly recommend, if you're doing robotics, that you take a good long look at this device and try it with several patients. I think you'll be very impressed. I know I have been.